Welcome to Public Health Conversations, hosted by Evon Cherry.
Hello, my name is Evon Cherry, and today's story is on the monkeypox. 2022 outbreak cases and data is what I feel that I will share with you first. Our outbreak case and data in the U.S. totals 25,616 cases. Thus far, we've had one death. Global cases total 68,017. Our U.S. map and case count. One Florida case is listed here and is included in the United Kingdom case count, but because that person was first tested in the UK. The map in our surrounding area, starting with Nebraska, we have 28 cases. Iowa, 25 cases have been reported. Kansas, 14. Minnesota, 195. Missouri, 103. Nevada, 266 cases. Colorado, 278 cases. So for further information on the map and the statistics, they're on the CDC website under the map and case count. Monkeypox. The first case of monkeypox in Nebraska, and this information is from the Department of Health and Human Services. As monkeypox infections are increasingly identified throughout the U.S. and the world, it's crucial that we continue searching for it here in Nebraska, says Dr. Matthew Donahue. He's our Nebraska state epidemiologist. Monkeypox is spreading through close contact with someone who has a characteristic rash. Nebraskans should be aware of the rash's appearances, and we need individuals with the characteristics of this rash to talk to their healthcare provider, and we can arrange testing. While monkeypox is not a traditional sexually transmitted infection, it can be transmitted through prolonged physical contact, such as through sexual intimacy. Currently, the outbreak is disproportionately affecting gay and bisexual men who are sexually active. However, anyone with prolonged physical contact with someone who has monkeypox is at risk of developing the monkeypox. It is important to be aware of the current outbreak and follow the preventive measures that I will give you about monkeypox. Symptoms of the monkeypox include a rash that looks like pimples or blisters that appear on the genitals, the anus, face, inside the mouth, and on other parts of the body like hands, feet, and chest. They have pictures that are posted on the CDC website that you can view. Also, the rash goes through different stages before healing completely. This process can take several weeks. You can experience fever, chills, muscle aches, back aches, abdominal pain, a rush feeling to use the bathroom, to pass a stool, but the bowels are empty, an urgency to defecate, conjunctivitis, inflammation of the mucous membrane around the anus, rectal bleeding and blood from the stools, and you can also feel exhaustion, the swollen lymph nodes, and experience respiratory problems. You may experience all or only a few of the symptoms. Sometimes people have flu-like symptoms before the rash, and sometimes people get a rash first, followed by other symptoms. Often others only experience a rash. How long does the monkeypox symptoms last? Monkeypox symptoms usually start within 3 weeks of exposure of the virus. If someone has flu-like symptoms, they will usually develop a rash 1 to 4 days later. Monkeypox can be spread from the time symptoms start until the rash has healed. All scabs have fallen off and the fresh layer of skin has formed. The illness typically lasts 2 to 4 weeks. If you have a new or unexplained rash or other symptoms, avoid close contact with others including having sex or being intimate with anyone until you have been checked out by your healthcare provider. Overall, our findings support that prolonged shedding of monkeypox virus DNA can occur in the semen of infected patients for weeks after symptoms onset, and show that semen collected in the acute phase of infection, like 6 days after the symptoms onset, might contain a replication competent virus and represent a potential source of infection. Viral particles in semen might derive from passive diffusion from blood, urine, and genital lesions, or local genital replication. If you don't have a provider or a healthcare insurance, visit a public health clinic near you. When you see a healthcare provider, wear a mask and remind them that the virus is circulating in the area. You want to protect the healthcare provider as well. I have monkeypox rash photos that you can view. Use personal protective equipment when caring for a patient. Avoid contact with animals that could harbor the virus. Avoid beddings of ones who's had the virus. Isolate the infected person from others who may be at risk to contact the virus. Practice good hand washing hygiene with soap and water or alcohol-based hand sanitizer. Prevention continued. The Department of Health and Human Services recommends that anyone who's experienced symptoms of an unexplained rash on their face, palms, hands, legs, genitals, or perianal region that may be accompanied by flu-like symptoms should contact their healthcare provider. For more information regarding monkeypox, the Center for Disease and Control has a website in your hometown. Testing. The Nebraska Health Laboratory is conducting monkeypox testing in Nebraska. The laboratory is not experiencing any shortfalls in test capacity, and results are frequently reported within 24 hours. Physicians should have a low threshold attest to patients presented with the characteristic rash. Commercial laboratories including AEGIS Science, LabCorp, Mayo Clinic Laboratories, Quest Diagnostics, and Sonic Healthcare are now beginning to test for monkeypox. This will be updated and as more laboratories come online. You can check this in your hometown. Currently, there is no treatment that has been approved specifically for monkeypox virus infection. However, antiviral development for use in patients with smallpox may be used to prevent and treat monkeypox virus infections. TPOXX is an antiviral medication that is approved by the United States Food and Drug Administration for the treatment of smallpox and may be considered following consultation with CDC for people who are likely to get severely ill with monkeypox. The ones who are immunocompromised, pregnant, or breastfeeding. This drug is currently available from the Strategic National Stockpile as an option for the treatment of monkeypox. Vaccine information. JYNNEOS and ACAM 20,000 are the two vaccines licensed by the U.S. Food and Drug Administration that are available for preventing monkeypox infections. Nebraska has received the JYNNEOS vaccine from the CDC and will work with local health departments to ensure availability for individuals who fall under these specific scenarios. The outbreak response monkeypox vaccine post-exposure prophylaxis, PEP, for those with risk factors that increase the potential of exposure to monkeypox, even in the absence of documented exposure to someone with confirmed monkeypox. This might include, but is not limited to, men who have sex with men who also have multiple partners, group sex or skin-to-skin contact at certain venues. Monkeypox vaccine post-exposure prophylaxis, PEP, for those who have close contact with a confirmed or probable monkeypox patient. The CDC recommends that the vaccine be given within 4 days from the date of exposure for the best chance to prevent the onset of the disease. If given between 4 to 14 days after the date of exposure, vaccination may reduce the symptoms of the disease but may not prevent the disease. Monkeypox vaccines for people who have a high risk of occupational exposure to monkeypox virus, such as laboratory technicians who are more likely to handle specimens that might contain monkeypox virus, and clinicians who are more likely to see patients with monkeypox virus. Here are some frequently asked questions. If an individual tests positive, how long should they isolate? If you are tested or diagnosed with monkeypox, you will be required to isolate at home, avoid close contact with other people and animals, including your pets, until all your rash lesions have resolved, the scabs have fallen off, and the fresh layer of skin has formed. This usually takes about 2 to 4 weeks. When isolating, what should a patient do? Isolate in a room or area separate from other household members and pets when possible. Limit the use of space, items, and food that are shared with the other household members. Do not share dishes or eating utensils. It is not necessary for the infected person to use separate utensils if properly washed. Avoid others until the rash has resolved, the scabs have fallen off, and a fresh layer of intact skin has formed. Bathroom usage should be separate. Upholstered furniture with porous material that cannot be laundered, consider using covers, and sharing should be avoided. Dispose of potential infectious bandages and bag clothing and bedding separately to launder. Hand hygiene is a must, and no sharing of any objects. Again, wear your PPE when necessary, always, if you are not infected, but you're changing the bandages and handling items of the infected individual. Last but not least, the home should be disinfected. See the disinfecting home and other non-healthcare settings from the cdc.gov website. Additional resources, you can contact your CDC here in Lincoln, Nebraska, and then there's a number 402-471-3120, or contact your healthcare provider in your area for statistic data, updates, and information on monkeypox in your area. My name is Evon Cherry, and thank you for watching my show on monkeypox.
This has been Public Health Conversations with Evon Cherry. If you'd like to leave suggestions, email us at ewcfacts@gmail.com. That's ewcfacts@gmail.com. This has been an EWC Communication production.